Good afternoon. My name is Marla McGuinness, and I will be your moderator for today's news conference. Before we begin, I'd like to introduce the Honourable Iain Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you. Today we're reporting just one case of COVID-19 and 7 recoveries. And that's a number of days in a row with single digits. We had a couple of days last week with double digits. That was just a little concerning, but those cases were connected and traceable, and people are isolating as required. So as an added precaution, we've added some testing into some Halifax communities, and I want to encourage everyone to get out and get tested, whether you're in Halifax or any other part of the province. And remember, it does take about 2 weeks, full 2 weeks before you have full vaccine effectiveness. So ensure you continue to get tested and follow the protocols. This is a big week for our vaccine program. We have 130,000 appointments booked, and 5% of those are first doses. So it's really great that people are still getting out to get their first dose of vaccine, even with 73% uptake that leads the country. And so the other 95% are second dose. So I want to thank everyone for continuing to do your part and getting vaccinated. We have opened a number of new vaccine sites, and we've doubled our appointments in many of our current clinics. And today, in addition to second dose appointments, the Convention Centre in Halifax is now open to walk-ins, and this is for people who have not yet received their first dose. So more news, we have actually hit 900,000 doses as a milestone today for doses into arms. So I want to bring in some people that are actually with us, joining us from the Convention Centre, some of the staff and people working there. So if we could bring them in. There they are. So I'd like to, first of all, thank you for your work you're doing as we celebrate the 900,000 doses, and welcome to the briefing today, and congratulations to all of you. Ramiro Lang, who is the clinic lead from IWK, is here today, as are Captain Clement from the Canadian Armed Forces, and Sarah Parisio from the Red Cross, and Kathleen King from the Convention Centre. So welcome. It was literally just a week ago, this is how fast we're moving now, that we visited you with the 800,000 doses. So 100,000 doses in just a week. So that's just incredible how fast everyone's moving. I just have a couple of questions, if you would, for our viewers. So Renette, you've opened up the first dose walk-in clinic. Maybe you can just tell us how it's going so far.
Yes, hi, good afternoon, Premier Rankin. We have opened up to walk-ins, and it's going very well actually today. We've immunized approximately 50 walk-ins, but we do have the capacity to immunize approximately 200 walk-ins. So we do welcome folks to come on downtown at the Convention Centre and get immunized. Today we have a mixed model of booked appointments as well as the walk-ins. So we'll be immunizing about 1,500 people today at the Convention Centre.
That's really great to hear. And so we know it's a one-stop shop for people if they want to get tested. There's still rapid testing available downstairs, I believe, so whether you're getting your vaccine or not. I'm just wondering if you're still seeing a lot of people going out to get tested.
Yes, we actually are seeing a lot of people getting tested. So there is the the testing center downstairs on Argyle, but we also have a pop-up upstairs in the observation area of the clinic. So folks are welcome to come in, get their vaccines, as well as get a rapid test for COVID-19. We're seeing a lot of folks that actually it's their first time getting a COVID vaccine, so it's been quite successful. About a third of the people that are coming into the clinic are getting a rapid test. So we're very lucky to have them around, and it's a one-stop shop. So we welcome you to come down and get both done at the same time.
That's really great to hear. Testing has been a key part of our success here in Nova Scotia, and we're as we start to get into phase 3 and opening up our borders a bit more, that testing will continue to be really important. So thank you so much, and I'll turn it over to Dr. Strang, who I know will want to say a few words to you.
Thanks, Premier, and thanks for all of you and the teams that are behind you. You know, a hallmark of our COVID response in Nova Scotia has been innovation, creativity, collaborative partnership, and I think the Convention Centre and the 4 of you standing there represent that. So it's wonderful to hear of the uptake already. You know, people walk in for first doses. We still have lots of room there. We need to get people who are rapidly growing. So just a great big thank you to you and all the teams that are there behind you.
So thanks to everyone who joined us from the Convention Centre. Keep up the great work on behalf of all Nova Scotians. So yesterday we opened up second dose appointments for those Nova Scotians that were vaccinated on or before May 30th. So our program is clearly working. We're well ahead of schedule. Our vaccine story is a strong one, but there are still some age groups that we need to see more of you, people especially in their 20s, who still need to get their first shot. So continue to look for all of the plethora of options that we have now out there, including the Convention Centre where you can walk right in. So just make sure that you are aware of why it's so important to get your vaccine. We have high aggressive targets that we still need to hit for our population, and consider if you think that you won't get sick just because people around you are vaccinated, that's not the case. And also remember that we need everybody that's eligible to get out and get their vaccine. That is a relatively high percentage, 90% of their new cases are that variant. And in Australia now, more than 10 million people are locked down because of the variant. Delta is increasing in the United States and has also, of course, been reported throughout the country, and we've recently reported a case here in our province. So the vaccine is our best thing, everyone around you and your communities. So tomorrow is an exciting day, opening up to the rest of Canada, and Dr. Strang will provide more details. And though we are moving in the right direction, business and industry require our support. So we're there to help. For example, Tourism Nova Scotia announced today a new $2.25 million program to market our province called Do More in Nova Scotia, and it's aimed at attracting more visitors to our province. Furthermore, Minister Kasoulis announced some funding, $2.5 million to help our small businesses modernize, provide more digital capabilities and online support. So we're going to continue to support, but we need Dr. Strang.
Thank you, Premier, and good afternoon, everybody. As the Premier said, we are reporting one new case today, and it's good to see the single digits for the last few days after some higher numbers at the end of last week. We are dealing with two clusters of cases, one in Central Zone with a number of individuals and families with many close connections. The other is in Cape Breton with several cases connected through their work. At this time, there is no suggestion of broader community spread in either cluster, and in both clusters, under-immunization is a significant factor. Nova Scotia Public Health is responding with mobile testing and vaccination for both these clusters as needed. And these types of clusters are while we continue to increase both first and second vaccine, vaccination, and maintaining measures such as limited numbers for gatherings, physical distancing, and masking remain so important. And as I've said many times before, the Delta variant, with its high infectivity and the need for 2 doses of vaccine to provide good protection, remains our biggest risk and why we are committed to a steady and careful reopening. So let's not give the Delta variant the conditions to thrive. Get your first vaccine and move up for your second vaccine. And take the second dose appointment as soon as you can find one. Moderna and Pfizer can be safely mixed. So it doesn't matter what your first vaccine was. Take the first appointment that you can get with Moderna or Pfizer. And doing this will give solid protection for you, your friends and family, and the Nova Scotians around you. For those who are getting a vaccine this week, like I was lucky to do yesterday morning, we are part of a record week. We have bookings to put almost 135,000 doses into arms this week. We'll also set a single-dose record today with over 31,000 vaccinations. We are providing the vaccine, staff, and locations, but it's Nova Scotians who are setting these records. You're getting first and second doses as quickly as they are available. And this is why we continue to lead the country in first-dose vaccinations. Almost 73% of Nova Scotians have at least their first dose of vaccine, and 20% now are fully vaccinated. That second number is rising quickly now that we're primarily administering second doses. So I want to say a huge thank you to Nova Scotians who have gone to a vaccine clinic or a pharmacy in your community. And to those who haven't, please get vaccinated. The vaccines are safe and effective. They've undergone extensive research and review, the same research and review that other vaccines are required to go through. Millions of people in Canada and around the world have received COVID vaccines, and they are well protected and safe. We've had a vaccine program underway since December, and we can see the impact of the vaccine, especially its contribution to our rapid control of the third wave. The vaccine is working right here in Nova Scotia. So there is no need to wait if you haven't yet had your first or second dose. For those who are sitting, waiting, wondering whether they should get vaccinated, book your first dose now to protect yourself. And if you're not that concerned about yourself, do it to protect those around you, your family, friends, and community. We have worked hard throughout this whole pandemic, Nova Scotians, of doing what's necessary to keep each other safe. And so the last and final step is in doing that, in doing what's necessary to keep each other safe, to care for each other, is by getting vaccinated. Getting vaccinated shows that you care for your fellow Nova Scotians. Tomorrow is the beginning of phase 3. We're opening up the province some more. I know some people want to move more quickly, but our steady and cautious approach has kept us safe so far. I won't go into all the details about all the differences between phase 2 and phase 3, or all the details of phase 3. All of those are on our coronavirus website, but I will offer some highlights. For an informal gathering, this is starting tomorrow. For an informal gathering, you will be able to have 10 people in your home along with household members. So that's household plus 10 for an informal indoor gathering. And physical distancing and masks aren't required. Outdoors, you can have up to 25 people for an informal gathering without distancing or masks. Restaurants, bars, and casinos can now stop serving at midnight and close at 1 a.m. And they can now have more than one live performer. Retail stores can operate at 75% capacity and following public health measures. Sports and performing arts can have, sports can have 25 people indoors and up to 50 people outdoors without physical distancing for games, leagues, and arts can have up to 15 people in groups indoors and up to 50 people outdoors for performances and rehearsals. Spectators are permitted for sports and performing arts based on the indoor and outdoor gathering limits. Faith gatherings, wedding ceremonies and funerals, and festivals, special events, and arts and culture events that are run by a recognized business or organization can now have 50% of the venue's capacity, up to a total of 100 people indoors, and up to 150 people outdoors. And in both of those, indoors and outdoors, physical distancing and masking as necessary as required. For travel, people can now come here from other Atlantic provinces without self-isolating, starting tomorrow morning. For those of you from New Brunswick who are in Nova Scotia, or Nova Scotians who recently returned from New Brunswick and are currently self-isolating, you can stop self-isolating tomorrow morning. And phase 3 is when we open to the rest of Canada, but in a safe and controlled manner. This cautious approach will keep COVID-19 and its variants under control. People who come here from other provinces outside of Atlantic Canada will be required to self-isolate based on their vaccination status. So people who are fully vaccinated, that means 2 doses of COVID-19 vaccine at least 14 days before arriving in Nova Scotia, do not need to self-isolate, but testing on arrival is recommended. People who are partially vaccinated, that means they've had a first dose of COVID-19 vaccine at least 14 days before coming to Nova Scotia, or their second dose, but it's been less than 14 days before they arrive. They have to self-isolate for 7 days and receive 2 negative test results in order to leave self-isolation after 7 days. And people who are not vaccinated, they have no doses of COVID-19 vaccine, at least 14 days before arriving in Nova Scotia, must self-isolate for the 14 days after they get here. And testing is recommended at the start and the end of their self-isolation. If you came from outside Atlantic Canada, and for one of the groups of people who were allowed to come here already, and you're currently isolating in Nova Scotia, starting tomorrow, you can switch to the isolation based on your current vaccination status that I just outlined, and the testing as I outlined as well. And when I say testing is recommended, I would say it's highly recommended. And testing is how we know where COVID-19 is and how to catch it right away. There are many locations where travelers can get tested, including at the airport. Both our airports now will have we have airport testing at the Halifax International Airport, and soon we'll have testing at the Sydney Airport. And for all Nova Scotians, we're asking them to continue to get tested, making it part of their regular COVID routine. Before I move on, I need to correct myself. The gathering limits for arts and culture was incorrect. It's 15 indoors and 25 outdoors, not 50. My apologies for the confusion. All the details and the correct information is on our coronavirus website. We are heading into phase 3 tomorrow and also into a long weekend. Restrictions have been loosened and you can do more social activities with friends and family. But remember, COVID-19 is still a risk. So be careful, be safe. Continue to follow the public health measures, including following gathering limits, wearing a mask, and following physical distancing. Get tested regularly and get both doses of vaccine. And I wish everybody a happy and safe Canada Day weekend.
Thank you. We will now take one question and one follow-up from media in the amount of time that we have. We'll begin in the room with Shayna Luck with CBC. Go ahead, Shayna.
Thanks, Marla. Dr. Strang, can I ask you about the two clusters, the one in Central and in Eastern? You mentioned that under-immunization was a factor there. Can you talk more about what does that mean? Is that anti-vaccination?
We got a number of people. Some of them, certainly the group, certainly in the Halifax area, and in the Cape Breton cluster, the smaller numbers there. Some of them have been children who under 12 cannot be vaccinated, but there are also adults who are eligible for vaccination that have not yet been vaccinated. So the point is that and this is what's happening across Canada, and we're seeing it in other countries as well. Where we're continuing to see COVID activity really take hold is where you have communities where there is a less than ideal uptake of vaccine. And with the Delta variant, that often means that the people have a single dose of vaccine, but they're still not well protected. For the other variants and the Delta variant, it can be no vaccine as well. The point is that the way we continue to push back COVID, the way we get to a point where we can actually safely reopen and start living with COVID longer term is having as high as possible rates of vaccination. Everybody who can get vaccinated needs to get vaccinated. It's about helping each other out.
Go ahead with your follow-up.
Premier, a question about the border. We're opening tomorrow to people outside Atlantic Canada. I understand people will have to fill in the safe check-in form. A provincial spokesperson told me yesterday increasingly people are being automatically approved as long as they can show their credentials at the border, their vaccination documents if requested. So I'm wondering, if we're automatically approving some people, why do they need to fill out a form in the first place?
Well, that's the first I heard this automatic approval. I can just say that we have a right to stop people at the border and ask for a proof of vaccine and ID and where they're coming from, but we're asking for them to do the safe check-in form if they're from outside of the Atlantic region.
Next book.
It's not quite automatic. I mean, people are expected, they have to upload the appropriate information, which then generates a letter for them, but they have to understand that they may well be asked both for that approval letter, as well as the documentation on their proof of vaccination when they come in, whether it's at the airport or at the land border.
Next we'll go to Paul Bacon with All Nova Scotia. Go ahead, Paul.
I actually think I'm good, thank you.
Okay, great. We'll move next to Tim Bousquet with the Halifax Examiner.
Good afternoon. The numbers certainly look great compared to what they have been in the past. I'm wondering if you can speak to the Pfizer-Moderna mix in two regards. One, children 12 to 19 can only get the Pfizer, and it looks like there's some limit to how much Pfizer is coming in the next few weeks. And I was specifically asked about pregnant women who unlike everyone else, they're being told not to mix doses. I just wonder if you have a response to this.
Yeah, the first one, and we're making sure that we have appropriate Pfizer. We have a reduction in Pfizer. We're still going to have lots of Pfizer around, and making sure that that is available for people. You're absolutely right. For the 12 to 18-year-olds can only have Pfizer at this point in time. My understanding is that NACI is recommending that, like everybody else, they're saying ideally, if you can, get the same vaccine with first dose and second dose. But what the overarching your priority should be is get the first available dose. And if that means choosing a different mRNA product, that's perfectly fine to do that, including in pregnancy.
Do you have a follow-up?
Yeah, the convention center walk-in clinic, the side of that, I was surprised to hear that there was just 200 expected a day and they've only reached 50. Does that speak to some reluctance of some population that just is hard to crack?
I mean, first of all, it's the first day. It's only been open for a few hours, 50 already. I wouldn't take that as necessarily a sign that that we're not meeting the demand. But you're absolutely right. The reason we are now going to walk-in, and we are looking at additional walk-in clinics in other parts of the province as well, is that we're getting to the point, the 20 to 30-year-olds. We're doing better with that age group than the rest of the country, but we still they're not doing as well as other age groups. Certainly, older age groups are higher vaccine uptakes, and maybe this is the parental effect. The younger youth are having higher vaccine uptakes. So we need to make sure that we have for the 20 to 30-year-olds, and walking is one way we make it easier for them. We're working with employers around vaccinating at workplaces is another way. We're pushing out lots of social media messaging, and this is why we're emphasizing today that even in that age group, many people think that they're kind of invincible. They're young, they're not going to get seriously ill. Well, even if we're not worried about yourself, we're asking you to do, like everything else through COVID, do it for other people around you. Do it for the rest of Nova Scotia. And quite frankly, for young people, if they want to continue to have restaurants open, they want to travel, well, the way they get to do that is by making sure they're contributing to the highest possible vaccine coverage rate. So there's lots of reasons for that age group to think beyond themselves and come out and get vaccinated.
We'll move now to the phone lines. We'll start with Natasha Pace with CTV. Go ahead, Natasha.
Thank you. Wondering, Dr. Strang, if you could talk a bit about when you expect more restrictions to be lifted for residents of long-term care homes who are still facing some restrictions.
We are part of phase 3. We're introducing, we're relaxing some of those restrictions, more for vaccinated residents than unvaccinated residents. I don't have all those details in front of me. I don't have them in my head, but all that information will be on our website. It's been communicated out through the continuing care sector, and we'll then in phase 4 we'll do even further relaxations in the continuing care sector.
Natasha, do you have a follow-up question?
Yes, I do. Can you explain, in the release it just noticed that testing is now recommended for people who are traveling to Nova Scotia from outside the Atlantic region and have 2 doses of vaccine. Why is testing recommended for people who are coming to the province, even if they are fully vaccinated?
Well, if you remember last week, this is because we wanted to align ourselves more closely with the federal government. Last Thursday, we said initially we had 2 doses. You would have to isolate and get a test, and then could come out of isolation once you got a negative test, which essentially meant that if you wanted to stop isolation, you had to get a test. We've removed that and saying you don't have to quarantine, but we're still saying it's a good idea to get tested when you come in, whether it's the testing at the airport if you're flying in, when you come across the land border. We have lots of access to testing within the first day or so when you get here. We're recommending that, just like we're recommending it in Nova Scotians, regular testing. And if you're coming from outside, having a test when you get here is just another layer of defense to check, make sure you're not infected with the virus in the first day or two once you've entered Nova Scotia.
We'll go now to Jesse Thomas with Global. Go ahead, Jesse.
Thank you. I'm not sure who this one will go to, but I'm looking at the border again. I'm just wanting to try to understand greater, what the presence is going to be looking like at those points of entry. starting tomorrow. Are we going to be having more border officials? Do we have an understanding of how many people are being deployed to help, make sure, people are abiding by the protocols?
I don't have the exact number. I was on a call earlier today. We're certainly going to have maintain the presence we've had, and depending on volumes, the ability to bring in more people at the airport as well as at the land border. And I think what we're doing is finding the balance. We cannot pull over every single car. There are streams, people coming from the other Atlantic provinces, as well as the people who are what we call have a commuter permission. They have a fast track stream. Other cars have to go through the slower stream, and there's a good chance, we're going to be there's going to be spot checks, and if you're coming from outside of Atlantic Canada, you have to understand there's a good chance you might get stopped. That you have to have your proof of your safe arrival permission approval, as well as your proof of vaccination, and the same thing at the border. So we'll be managing this based on volume and what's necessary to do this kind of monitoring and spot checking of various travelers as they enter.
Jesse, do you have a follow-up question?
Thank you. I guess I just wanted to switch from the border now to the vaccination rate. We heard people in the 20s, many still need to get their first shot. Do we roughly know what that number of population is? And what's the strategy, perhaps, to change that from the province to get these people on board to get that vaccine uptake?
Well, it's looking in the 20 to 30-year-olds about, between 60 to 65% of them have had either one or a small number with both doses. So we still have work to do there. And as I said earlier to a previous question, walk-in is one of the things we're pushing to make it easier for them to get vaccinated, focusing on workplaces, working with partners to make sure, accessibility is as optimal for them as possible. The other piece is using social media. We have a number of popular Nova Scotians, artists and others who are using on social media. Trailer Park Boys are one of them that are really giving a message in a way that resonates in social media ways that young people get information. So we're using all different ways to get good information, as well as to make sure there's good access. And we'll continue to monitor this and be creative and innovative to get to where we need to be.
Now we'll go to Keith Doucette with the Canadian Press. Go ahead, Keith.
Good afternoon, Dr. Strang. I sense the theme today that you were pushing the idea of vaccine almost as much as you were the opening of the border and the next step, phase 3. I suspect it's not an accident, but I wonder if you could talk about that. Is there a bit of unease on your part in terms of this reopening, especially at the border, or are you fairly confident moving ahead? Can you just talk about those two issues?
Well, we've gotten through the first two phases, and our epidemiology remains stable. We certainly are taking on more risk as we open our borders, remove restrictions to people going back and forth to New Brunswick, open up in a modified way for the rest of the country. Absolutely the appropriate thing to do, but we have to understand that we are taking on more risk, and so that's why the way we mitigate that risk is really pushing the vaccine message. That's our primary line of defense, but also maintaining things like masking, physical distancing, limiting the gathering numbers, and relaxing those in a slow, careful way over the coming weeks. We have to have certain layers of defense here while we open up necessarily and invite more people into Nova Scotia.
Keith, do you have a follow-up question?
Yeah, Dr. Strang, I heard all the numbers today about vaccine, but are we still on track to get to those lofty goals that you've set, or do we need to put a little push on here?
We're still on target. Our vaccine uptakes and our vaccine supply delivery still puts us on track to getting, hitting our minimum, and I emphasize minimum, our minimum level of 75% of all Nova Scotians with 2 doses of vaccine by the end of August. Ultimately, that depends. If we get more vaccine supply, we can go a bit faster, but ultimately it depends up to Nova Scotians. It's the choices Nova Scotians are making, and by and large they are coming out. We've talked a bit today about some of our challenging areas, but we have to understand that even for the younger people, they're doing better in Nova Scotia than many other provinces, and they haven't had as much time to get vaccinated. We've still got July and August, so we'll work at that. I fully believe that we will get those high levels of vaccine coverage change as we move through the summer. Nova Scotians have always responded for the last 18 months to do what's necessary for the pandemic, and I don't see vaccination being any different.
Next, we'll go to Nushin Ziafati with the Chronicle Herald. Go ahead.
Thank you. Dr. Strang, when we got a mini spike in COVID cases recently, we were told the cases were close contacts within a linked group of families. Was that link actually school transmission?
No, we had a couple of cases, or I think 2 or 3 cases from that cluster who were actually in schools, but there wasn't transmission within the school setting.
Nushin, do you have a follow-up question?
Yes, I do. Thank you. And do you think with our case count and vaccination levels, it'd be safe to call a provincial election either this summer or sometime in the near future?
That's not a question for me. There's lots of other considerations there.
I can certainly say we're focused on the reopening plan and the health and safety of Nova Scotians as we slowly, we're moving a lot slower than other provinces, so I think it's quite obvious that our focus is safety right now.
Next, we'll go to Kiera Moreland with Radio Canada.
Hi there. I'm not sure who this question would be for exactly, but I'm just wondering, since our third wave was caused by people, not fully respecting isolation, can we expect to see more enforcement for the people that will still have to isolate, or more checkup on them?
So we'll continue to use the measures we have, the safe check-in, which then gets people registered. Those who are meant to be quarantining, doing the daily digital check-in that we have in place, and then referring people to law enforcement as necessary. So we'll continue to use those tools that have, nothing's 100%, but they have in general have served us well throughout the pandemic.
Kiera, do you have a follow-up question?
Yes, thank you. I'm just wondering, for our pop-up testing sites, will people coming from other provinces be able to use these, or will they just be for Nova Scotians?
No, we're working at that. We want to encourage people who are visiting from elsewhere to also adopt the testing culture that we have here in Nova Scotia, for the next few weeks as we reopen.
We'll go next to Victoria Walton with The Coast. Go ahead, Victoria.
Thanks. I'm wondering, Dr. Strang, we have the rapid testing pop-up, and I'm not sure how much you can speak to those, but where July 1st is a holiday, it doesn't seem any rapid testing sites are going to be open that day, that a large portion of the population would be off. Do you think that there should be some more testing on that day?
I haven't been involved in the operational planning of all those pop-ups. I was aware of that. Much of that is volunteer driven, and it may be that they're having challenges with staffing those clinics.
Victoria, do you have a follow-up question?
Yeah, thank you. And I just wanted to clarify, I guess, as well. So you're saying people who are currently self-isolating, if they've come back from New Brunswick, they can stop self-isolating tomorrow morning, even if the 14 days aren't up, same as if they're coming from somewhere else in Canada and their 14 days aren't up, but they now switch to the 7 days. What's kind of the epidemiology reason behind that? Sorry, like if someone's in isolation and if they've come from a certain place, it's not going to magically change tomorrow morning that they're not infected.
I mean, the vast majority of these will be people from traveling back and forth through New Brunswick, Nova Scotia. We know that both provinces, the epidemiology is very low, so we're really not taking on any substantive risk by treating them fairly. That is, it doesn't make a lot of sense if somebody came from New Brunswick on Monday, has to do 14 days versus if somebody comes on Wednesday and doesn't have to do anything. So we're going to treat people fairly. We have small numbers of people so far who have come from outside of Atlantic Canada. And again, from a fairness perspective, treating them the same as we open our borders on Wednesday, we're not taking on any substantive risk with those small numbers.
Next, we'll go to Pat Healy with The Laker. Go ahead, Pat.
Hi, thank you for taking my question. Dr. Strang, last week I saw a tweet from Dr. Bogas in Toronto. He tweeted that Nova Scotia showed a masterclass in how to manage the COVID-19 pandemic. What are the key factors that contributed to, in Dr. Bogas's words, a masterclass?
Well, that's nice of Dr. Bogash. I mean, I could give a long answer. The very short answer is our innovation that we've done around public health follow-up, around testing, and now our vaccine. The huge amount of collaboration across government and across the health system, people coming to the table, being solution-oriented and action-oriented. But by and large, the biggest factor is they come back to Nova Scotians. Their willingness to do what's necessary, whether it's lockdowns, whether it's adopting, the wearing of masks, and now vaccination. Do what's necessary, and people picking up the approach that it's not about themselves, but it's about doing it for others and keeping their family and their community safe. And that's a message we need to finish that off by having people adopt that for the full vaccination as well.
Go ahead with your follow-up, Pat.
Yes, also for Dr. Strang and maybe Premier Rankin, with the need to get more vaccinations in the 20 to 30-year-old age group and in general overall, would Nova Scotia ever consider doing a mass vaccination event like they just did at the Scotiabank Arena in Toronto? Nearly 27,000 COVID-19 vaccines were done on Sunday.
Well, I think we're doing a kind of on a scale that's in Toronto, right, with more people, millions more people than in all of Nova Scotia. But at an appropriate scale, that's exactly what we're doing at the convention center. And we're also looking at some other things that, if we need to, that some other creative ways that to get to the vaccine levels that we need to.
We'll go next to David Kosh with Times and Transcript. Go ahead, David.
Hi, for Dr. Strang or Premier Rankin. Dr. Strang, you already said that Nova Scotia will maintain a presence at the land border. What can travelers from New Brunswick expect if they're driving across the border in terms of protocols and requirements? Will most people with New Brunswick plates simply be waved through?
Yeah, people from New Brunswick, we have essentially two streams. It's the Atlantic Canadians and people for a long time, truck drivers, people who travel across that land border on a regular, if not daily basis for work, etc., what we call the commuters. They have a fast-track stream, and they won't be checked. Anybody else has to go through the other one. As I explained, there's the possibility they may be pulled over and asked to, validate their approval and validate their proof of vaccination.
David, do you have a follow-up question?
Any message to people who are unhappy about last week's decision to keep limits on travelers from New Brunswick?
I would just say thank you for your patience and allowing us for more vaccine uptake. We now have an extra 100,000 roughly doses into arms. We really needed that extra week, and those that are in our province already can stop self-isolating tomorrow. So thank you.
Next, we'll go to Jean Laroche with CBC. Go ahead, Jean.
Good afternoon. Dr. Strang, quick question for you, which revolves a little bit around what Natasha Pace asked you earlier about long-term care. Despite the fact that you are giving them some extra privileges, they still won't be able to get together for family dinners or family outings. They can't be as free as they would like to be. And I'm just wondering, what justifies preventing these people, who many of whom have been double vaxxed, from actually spending time together? You have said repeatedly that it's been hard on them.
Absolutely. We certainly a lot within their facilities. They have really, they're back to group dining and lots of activities, people coming in, hairdressers, etc. It's when they go out into the community. We have to understand that many of these people, even if they got 2 doses of vaccine, this is a group that is likely to not respond optimally to the 2 doses of vaccine. So we will continue to relax and give them more ability to visit with family, etc., as we get into phase 4 and beyond. But this is another place where we need more and more vaccine coverage in the community to protect these vulnerable seniors when they do go out into the community.
Go ahead with your follow-up, Jean.
Dr. Strang, other provinces are lifting restrictions faster than we are, including the obligation to wear masks. How will that factor into future border restrictions, if it does at all?
Well, my view on this is that, especially July is a risky month. We're opening up, letting many more people in. And as I've said previously today, we have, vaccination and 2-dose coverage is a primary line of defense, but we still need all these other measures. So distancing, masking, getting together in limited numbers. All of those actually, as we've seen throughout the pandemic, play an important role of limiting the spread of the virus if it's here, and keeping it into smaller groups if it does spread. So my firm position is that we need to hold on to these, what I call the more personal measures, personal protective measures, at least through July, while we introduce the risk that is inherent with having more people come into the province. And once we've done that and we see where we're at with our vaccine coverage and see how the month of July is gone, then I think we're in a space to say, okay, what can we start to then relax in terms of moving away from requirements around masking, as an example.
And the final reporter on the line today is Elizabeth McSheffrey with Global. Go ahead, Elizabeth.
Thank you very much. My first question is for Dr. Strang. I'm just wondering, and I apologize, I can't remember if it was you or the Premier who mentioned that, some young people may have a tendency to think that they're invincible, and that may, contribute to the lower vaccination rates. Is there any research going on right now to determine why that age group has the lower vaccination rates? What do we actually know about their motivations and thought process?
Well, that's what there is. You can say this is real time. It's hard to do that research and get the definitive answers, but we can look at previous research in other health behaviors in this group, and the invincibility is one part of it. But we know in general for vaccination that giving people good information in a way that they can understand and a way that makes sense to them, making sure they have ready, easy access to vaccination. All of those things we're doing. So we're based on well-known principles of health promotion, if you will, that we're targeting as we can, adapting and being more innovative within our vaccine program to try to reduce the barriers for specifically for this age group.
Elizabeth, do you have a follow-up question?
Yes, thank you, Dr. Strang. A lot of people, or some people may be waiting to see how vaccination goes before getting a shot themselves. They may be wanting to see the long-term effects, or some people might not get around to getting vaccinated right away. Is there a national conversation right now happening about how long COVID-19 vaccines will be available? Will someone be able to get one next year, 2 years down the line, if they decide at that point they want a COVID-19 vaccine? What conversations are happening about that?
Well, there's a lot of research going in, much more the longer-term future of COVID, living with COVID, and what role COVID vaccine plays longer term, whether we're all going to need a booster dose, or some of that depends on, variants. So there's certainly no definitive answers. The science is not certain on that, and how long we, try to encourage, have vaccine available for folks. But I would say if people are waiting, don't wait. We know that these vaccines have gone through exactly the same safety and effectiveness trials that any other vaccine has done. It's just because of a concerted effort with a singular focus on these vaccines, it was able to be done faster. That these vaccines, and we've got now what we call post-market experience, millions of doses across the world that show that these vaccines are safe and effective. So if you're waiting for more evidence, you don't need to wait. It's there. Get vaccinated. But that's why I say, even personally, if you want to reopen and you want to be able to travel more, if you want to have less restrictions, you want to be able to go out for dinner, go to a theater, whatever, well, the way you do that is to contribute to our collective effort to lift the restrictions by getting vaccinated now, not waiting. It's about caring for other Nova Scotians like we've done all along by getting vaccinated now, not waiting.
And that concludes today's news conference. Go ahead, Premier.
Thank you. Tomorrow we welcome family and friends and visitors from outside of the Atlantic region. It's exciting but may seem a little scary. Opening up to the rest of the country does present some risk, but is one that we believe we can manage. 73% of Nova Scotians have their first dose of vaccine. And second doses are well ahead of schedule. I actually just booked my appointment for tomorrow, and that's 2 months ahead of schedule for me. So while you might feel nervous and hesitant about opening up, we have a number of measures in place to mitigate that risk. If there's an outbreak or a cluster or we see an anomaly, our system is agile and we can move in quickly to manage that. For now, let's not worry about what if. Let's think about how good it will feel to see your family members or friends who you haven't seen in a while. Think about that face-to-face conversation rather than doing it on a screen. And there are some families who haven't seen each other in over a year. Tomorrow we give families and friends an opportunity to make new memories in person. And think about the businesses that have managed through lockdown after another, who depend on tourists for their livelihood, but who have not been able to welcome any. Now finally we can celebrate a tourist season. We can celebrate all those who miss birthdays and anniversaries, all those special occasions. We can celebrate this great province and all it has to offer. For the first time in a very long time, we can celebrate it together. After all, we have always been, forever, will be, stronger together.
I just thought of something just now. Tomorrow is the last day, official day of school. And I just want to personally thank, it's been a difficult year for school, but we've done well in Nova Scotia compared to many other places. We've had most of the school year in school. So I just want to personally thank students, staff, teachers for all they've done to get through the school year by keeping each other safe. Have a good summer, and we'll come back next year with a much more normal school year. Thank you.